All right, we'll
Take
take
it
it
away.
away. I'm going to make a few comments and then ask Dr. Barker to make a few of his own. We have some very exciting news to announce today. We have reached an agreement as of this morning, thanks to lots of hard work on this team, but to acquire Hellstat. And so Hellstat is an organization similar to ours based in Charlotte, North Carolina. They've been in business for 20 years with a large presence in the Southeast. Will dramatically expand our footprint. Right now, we have about 120 clinics in almost 20 states, I think 19 or 20 states, and we're adding 230 more clinics in 13 additional states. So that will give us a grand total of about 370 clinics in 32 or 33 states here once this is complete. It won't close until about 30 days from now. And we won't announce this until next week on Monday. So I ask you all to please keep this confidential. We'll probably say that several times, but we won't have an official announcement go out externally until Monday. So please keep this under wraps over the weekend. But it's worth noting there's a couple reasons why I'm really excited about it. They have similar mission and values. It's very similar to Activate in terms of how they align themselves and the culture that they've built. We'll be able to impact a lot more lives together and most importantly, drive much better clinical outcomes. And we'll create a total cost of care saving solution for the clients that we're serving and really a massively differentiated experience for both clients and patients based on our legacy and best practices, Activate's legacy best practices, and now Hellstat's legacy and best practices. And doing all this together, we'll have a lot more resources and a lot more capacity as an organization. So again, this remains confidential, so please keep this under wraps. I'll have a few FAQs to respond to here in just a second, but Dr. Barker, I asked for you to make a few comments.
Thanks, Chris. Yeah, I'm happy to provide my perspective on what this could mean clinically for us. What we do know, as you said, is that this acquisition doubles our footprint nationally. So it really solidifies us as a leader in the market and puts us, I would imagine, on the short list of, Kirk is virtually nodding his head, but puts us on the short list of every major client in the US who's looking at value-based clinical care. I mean, we're huge now. And so while we're still learning a little more about Hellstat's clinical structure, I'll share what we do know. Their model utilizes advanced practice providers for the majority of their care provision. And in fact, we'll be adding 500 APPs to our organization. The majority of their service offering to clients has historically been for urgent care, but some time ago, they realized, just as we did, that the maximal value to clients and their employees is to be overseeing the patient's entire healthcare spectrum. So as a result, they've been offering direct primary care for their clients in a model very similar to ours, but this clearly gives us an opportunity to share our experience and our expertise in providing membership-based, employer-sponsored direct primary care that we've been doing. So we'll evaluate where it makes the most sense to expand their current offerings into an even more comprehensive, complete care offering with primary care as the foundation. But I'm excited that they're bringing a lot to the table as well. They're really known to be experts in the occupational health area, and they have a few new products, including an intriguing new behavioral health product that I'm eager to dig into. Behavioral health being a real pain point in every provider group in the U.S. Also, because I know we'll be asked, the EHR they use is ECW. So, I know that one EHR team is going to probably take that into account as well, but they're on ECW. So I'm really excited to combine the expertise that we've established in this space with the strength in ancillary services that they have, and frankly, that the marketplace is looking for. And I'm really excited about bringing the organizations together. We will have more resources, we'll have more expertise, which really is the foundation for innovation. It's really surprising to think that less than 2 years ago, we were 45 clinics in 9 states, and now we're 370 clinics in 35 states. So thank you all for continuing to embrace change and opportunity. And we really are now truly positioned to become leaders in the nation's delivery of healthcare. And I couldn't be more excited by that. So I'll turn it back over to Chris. Thank you.
Thanks, Tobias. And there, you hear a few different numbers in terms of number of clinics and number of states. And the reason is because there's expansion plans. I think we're expanding potentially into Iowa. HealthStat's expanding into a few states in the near future. So it'll be around 32 states with a few more on the horizon, and I think 370 clinics. But let me answer a few questions that may come up. We're not going to take questions today, but I know these are top of mind. There is an integration plan, and we brought on an outside consultant to come in and help us to do that. It's a bit different from how we handle it with Activate. The consultant's going to and has already started to help us put together a plan, and we've got a 180-day plan to complete integration. So it'll be a little bit more aggressive in terms of what we're doing along those lines. Everybody's job remains the same. So please rest assured we're going to take on best of both worlds. We need more people to help us build a successful and large organization to handle the additional clients we think we're going to take on. So that's in place. The new brand name I know is top of mind, and that is going to be released in the next month or so. And HealthStat will fold under the new brand name as well. So we'll have one name for all three legacy organizations. Dr. Barker mentioned ECW. And I think the last question is, hey, why are we interested in expansion this way? And look, we continue to grow organically without acquisition pretty aggressively, 25 to 35% growth year over year. But the acquisition continues to help us grow. And we found a like-minded, mission, values-driven business that, again, was very much aligned with what we want to achieve, with a presence in the Southeast where we don't have a presence. And so it made a lot of sense. There continues to be some rapid consolidation in this space all along healthcare, really, but especially in the direct primary care space. You saw Marathon acquired Our Health not too long ago. And so, we wanted to get ahead of this. HealthStat had been approached by a lot of different competitors in our space. And when we talked to them, something clicked. And so they liked the idea of having HealthStat land within Paladina Activate. And it worked out quite well. It wasn't easy to do, certainly in this pandemic. And I commend all of the teammates who were involved, with specific kudos to Romilly, who helped carry us across the finish line with her legal expertise. We are lucky that we are backed by very strong investors who allow us the opportunity to do things like this and take on additional assets through acquisition and help us grow and impact more lives and achieve that mission to transform healthcare. So I'm also thankful to our investors and shareholders for allowing us to do that. I know that there will be many, many more questions, and so I don't pretend to have answered all of them now. Please reach out to your supervisors and leaders, anyone on the executive team, and we're happy to answer those here as we go. And we look forward to continuing the discussions. And frankly, we look forward to what we think is a very, very bright future in our effort to continue to transform healthcare and impact more and more lives. So I thank you all for your very hard work. I hope you receive this as happy news as we do, and look forward to sharing more here as soon as we can. And again, please, one last reminder, mum's the word, please keep confidential external announcements going out at some point on Monday. I'm not exactly sure of the time, so please be conservative and keep this to yourself. Thanks, team. Tobias, any last words?
I just you just signed it, Chris, a couple of hours ago. So this is really hot off the press. And so this isn't, we wanted to share it with everyone as soon as we possibly could. And so, thanks to Chris for wanting to immediately share it with the teams. We timed it so that we started with the clinical things first, because I know that everyone's going to, their mind will probably be in a lot of different places. So we ended with this, and it's actually the end. It'll be the end of this meeting. So as Chris said, reach out either in this Q&A chat or to your clinical or your ops leaders with more questions if you have them. As we learn more, we'll share it. Now that this is done, I think we can dig deeper and get more specifics than we were able to before. So eager to learn more and to share it with all of you.
All right, thanks, team.